Hi, it's Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor. This video is about why medical doctors overprescribe psychiatric drugs. There are 1 in 6 Americans are on a psychiatric drug. That includes antidepressants, stimulants like Ritalin for ADD. That includes anti-anxiety drugs, types of drugs like Valium. So they are way overused. And it's hard to find somebody that would debate that. It's not the ideal scene, meaning if you want to feel better, you don't take a pill to feel better. You change your diet, change some lifestyle things, and then you feel better that way instead of relying on a pill. So I was looking into why medical doctors overprescribe psych tools, and what I did is I looked back at their original education, and I'm comparing the medical doctor education versus the chiropractor education. So I'm doing this because I'm a chiropractor. And so number one, comparing the two schools, allopathic medical versus chiropractic, medical doctors get less education on anatomy, physiology, and diagnosis. So compared to chiropractors, the schooling provides less education on how the body actually works and how to diagnose it. And then there's more education on psychiatric training, psychology too, by a factor of times 5 hours during the schooling. That's a lot of psychology and psychiatry. The medical doctor's license is very restrictive in that if they do something outside of what they're told to do, then they can get in trouble. They got to go before the board, and it's all controlled by big pharma. So the board, the education, and the licensing is all controlled by big pharma. Number 4, their tools are very restrictive. They have to focus more on knives and poisons. So the word pharmacology comes from the word pharmakon, which means poison. So you're either getting cut or you're being poisoned in a medical clinic. So, and their focus is zero on how the body and brain actually work and how to repair with plants and glands, meaning like liver glands, whether you eat liver or you take a pill, you're working with Mother Nature. So the focus is zero on working with Mother Nature. Now there are some people that need psychiatric drugs because their physiology is far beyond what plants and glands can do. But by far most people are on psychiatric drugs without ever having gone through a proper nutritional workup, and oftentimes not even having gone through a proper medical workup. So somebody comes in a doctor's office and says, I'm depressed, I have a hard time getting out of bed. They say, oh, you're depressed, you need Prozac. Instead of saying, what do you eat before you go to bed? Are you eating popcorn? Are you eating sugar? What do you have for breakfast? And this is very easy to fix most of the time. I've seen people go on antidepressants because they have an infection, and the doctor is just being stupid, or the doctor wants them to shut up. I've seen people go on psychiatric drugs when they should be on thyroid medications. You can't believe the scenarios that I've seen where the medical doctor just goes back to this because of their education, because of their license, because of their tools are restrictive, and it's kind of like the default. So online somebody was tweeting out that she was at a medical conference for orthopedics, and at the conference they said, if you can't find the organic cause of their back pain, send them to a psychiatrist. Just because an MRI or an X-ray doesn't show you the cause of pain doesn't mean that they're crazy. It means that the doctor needs to go hunting further and further, looking for the cause. Maybe they need to get referred out to a chiropractor, massage therapist for some body work, or maybe they need to see a nutritionist to change their diet around. So I have a list of hours for this chiropractic school that I went to at the time that I went to it. I graduated in 1997, and here is a list of that school's hours of education on different courses versus 126 allopathic medical schools. Here's a chart comparing the allopathic program versus the chiropractic program at the National College of Chiropractic. That's the school that I went to, and this data is from the years that I went there. I graduated in 1997. You can see down here that the data is collected from 125 allopathic colleges in the Association of American Medical Colleges, 1996 to 97, curriculum directory. And then the red bars, that's from data collected from the National College of Chiropractic 96 and 97 bulletin. And so I graduated in 97. So I'm comparing my education versus 125 allopathic colleges at the same time. So starting at the top, you can see the allopathic doctors get way more pharma. Okay, obviously that's their profession. And then they have pathology here, and we got more by 100 hours, more pathology, like how does the body break down? How does it fall apart? Microbiology is the same. Public health, they get a little bit more. Nutrition, I got way more times 5 when it comes to nutrition. Genetics, basically the same, around 30 hours. Physiology, I got double. Physiology, how does the body actually work? That includes cells. How does cells actually work? There's x-ray anatomy. Here's neuroanatomy. We got a little bit more. Biochemistry a little bit more. Histology a little bit more. Embryology a little bit more. And then gross anatomy, we got a lot of that. Almost double gross anatomy. I spent 9 months in a cadaver lab. It was very intensive. And yeah, overall, chiropractors get more hours in their 4 years than medical doctors do. And I've seen other graphs like this where there's been a sort of dichotomy, if you will, on the hours of the course called diagnostics. So I've seen some graphs show that chiropractors get more diagnostics, and then other graphs show that medical doctors get more diagnostics. But the point here is, like, if you know how the body works and you know how it breaks down and how to fix it, then you don't have to rely on psychiatric drugs. Here's another chart I found online talking about the chiropractic education on the left and medical doctor schooling on the right. And I want to drop down to the very middle. We have 408 hours of chiropractic education on diagnosis and then 113 with the MDs. But the point of this whole video is the psychology and psychiatry. 56 hours in the chiropractic field and then 6 times that in the medical field. So this is one of the main reasons why psychiatric drugs are overprescribed, because of the education and then of course their license. But any medical doctor could just say that they're not going to focus on the psych drugs anymore, and they can really focus on actually fixing the body and figuring out like what is happening with your body and why you feel depressed, or why your kid has ADD, or why your parent is anxious. So here's the total hours: 2419 for chiropractors, 2047 for medical doctors. So if you're a student considering getting into healthcare, I would like to recommend to you to check out the chiropractic license, because it's a nice solid education. It's 5 years, and you get great education on the anatomy, physiology, and diagnosis, and your license is wide open with herbs, homeopathy, diet, and body work. And you can get a lot done for the majority of people by doing those natural tools. So if you like this information, please give me a thumbs up and share with a student, and subscribe if you're new. Hit the bell for notifications, and you can contact us if you need help because you want to get off psychiatric drugs. They're very addictive, they're hard to get off for a lot of people, and you got to do natural things to give your body the best chance of getting off these kinds of drugs and preventing the need for the future use of them.